Hi guys, welcome. My name is Theon Sims, and just welcome to the Limitless podcast. Joining me as always is your co-host, Dr. Matthew Preston. Hail up the people, Matthew.
Hey guys, what's good?
And joining us is the famous Skyn by Dr. Kym. Give her a round of applause, guys. Woo! Yeah.
Hi,
Welcome, Kym. How you doing?
I'm great. I'm tired, but I'm good.
Yeah, I can see you're at work, and we are recording on a Sunday. So, yeah, you work every day?
Well, the office opens 6 days, Monday to Saturday, but I work every day. So I'm here on a Sunday. I just finished a patient.
Okay, nice. Okay, so Kym, so welcome to the podcast. Thank you so much for coming. I've for our listeners, I've known Kym for it's approaching maybe a year now.
Yeah.
Yeah, I see her at her workplace sometimes at Summit, and we met a little bit around a year now. And yeah, it's been good. We've been at a lot of different events. She's been teaching me some stuff with her side of the business, aesthetic medicine, and so on. So it's been a fun little ride.
It is.
So Kym, I want for everyone else that doesn't really know too much about you, can you just share a little bit about yourself and what inspired you to pursue medicine?
Okay, where I did medicine, there was actually a backup. I wanted to be an architect, like my brother. And when I was about to apply, I realized I didn't have the CAPE level courses or subjects that I needed. So I had to fall back on the science subjects, and then I did medicine.
Wow. A
Yeah,
backup.
that was really it. And throughout medicine, halfway through, I actually wanted to leave. I wrote a letter of withdrawal to come out of the program. Still ended up staying and
Wow.
went through. I've been a doctor for next year in July, would be 9 years. 6.5 of that was in the public system. Then I left and went private, did aesthetic medicine, started with a Russian university when the war started, couldn't get my certificate, so I had to start over and did board certified aesthetic medicine in Florida. Also did specialization in anti-aging, but before that, during the pandemic, I had done a specialization in epidemiology and public health through Johns Hopkins Bloomberg School of Public Health, and I also did through University of Washington a diploma in leadership in global health. I did some fashion designing back in the day. Was
My
invited to Caribbean
goodness.
Fashion Week. Didn't continue with that after COVID, but I think I'm quite artsy. I'm a creative, but I ended up in science. But I guess
Wow.
aesthetic medicine threw a little of the science with art, because I mean, beauty is art. So
That
that's
is
where
true.
I am. And now I guess I'm an entrepreneur and I'm jumping more into business. In my head, I'm not a doctor anymore. I'm an entrepreneur.
Right? Wow, you've gone through quite the roller coaster of I don't know, jobs and just
Yeah.
interests and so on. Right? Can we? I want to kind of streamline that a bit because you said you had a lot of challenges even before med school, and then during med school you wanted to drop out. What
Yeah.
was it for you that made you say, "Oh, I wanted to
Yeah.
kind of just drop out. This may not be for me." What was it
Because
at the
as I
time?
said, initially I didn't want to do medicine per se. I think why, it was in the back of my mind to do, and I think it came from the fact that when my father passed, I was in Fort Farm at Campion, and the emergency response to him, there was just not existing. And I think if we had a better emergency medical system, maybe he could have survived, maybe. But again, I wasn't a doctor at the time. So that fueled my interest in being in medicine and changing that system. But I guess as I went on, I said, I just follow what my brother did and become an architect, and it never worked out. So I think throughout medicine, because my initial interest wasn't really medicine.
Yeah.
Medicine is not easy. You guys know that. So when you really
Yeah.
didn't want to do it, and then you're here, and then throughout med school, at that time when I decided
Yeah.
to stop, I had to take care of my 4-year-old sister. So I was taking care of a toddler while doing medical school. It was very difficult. So at the time I said, I really can't continue doing this. And that's when I decided to withdraw from the program. I mommy talked to me and said, no, please don't do it, don't do it. You know, if daddy was here, would you want to? And so, you know, you go through it and you go through it and you said, okay, I'll stick to it. And it was difficult because I had to pay my way through medical school.
Mm-hmm. Not
Scholarships.
easy at all.
Yeah, it was hard trying to get scholarships. Sewing, so at the time I was sewing, trying to sell clothes to make money to pay tuition. So it was very
Mm-hmm.
difficult. So med school for me wasn't nice. I hated it. It was
Yeah.
absolutely difficult. You know, I was just
Yeah,
ready to get out of
especially
there.
if you don't like it.
Yeah, it's
So
really
if it's not
tough.
what you really, that's something I tell people all the time, especially when you're younger. If you really know you want to the medicine, then go for it. But if you have
Yes,
doubts, please
Yeah.
look
don't.
It's
elsewhere.
gonna be hard 'cause, like when the pressure starts to hit, if you really don't
Yeah,
want to do it, it's gonna be very hard to push through. Like
Hmm.
I you
exactly.
know, like there are lots of kids who, like, their parents are doctors, and then their parents want them to be a doctor too, and then they push them into it, and they're just like, I don't want this, and then it's just struggle through. It's messed up.
Right. And then with the money we spend in med school, if you're paying for medical school, you know, out of pocket, and what it is now, back when I was, you know,
Yeah,
in
even like
school in
now,
2009.
wow,
I
now it
mean, since
is.
you talk, we know about investment. When you come out with the salary you make, it's not a return on, it's not a good return on investment.
Yeah.
Hmm. And you're
And the
paying
only
down
thing I
this
would
loan.
say, the only thing I would say is now, well, if you like, for example, for us, Theon, in our
Hmm.
year, if people got the subsidy, if you look at it, the amount that it costed compared to the new salary increase, it actually was a good investment, I'd say.
Right,
But if you
right.
look at, like, if you're paying the full fee now,
Which is
even
like
with the salary increase, it's
4.3,
still,
It's still,
because
4.5.
if you think about it, I think they killed the subsidy, right?
Yeah, so
yeah,
they're
yeah.
paying like a full 4 point, almost like 4.5 mil a year.
And, and when I did medicine, I didn't get the subsidy because I think I was in that first year when they started taking big numbers. So
Mm.
they told us they didn't have enough to give us subsidies. So you either take a bursary from the university, which you just pay half, or you sit out the year and wait for a subsidy. So I just went ahead and took the half. So
Well, I mean, you've transitioned now. So after med school, you practiced at where? Did you go to KPH? You look like you went to KPH.
I went to everywhere in Sierra except for Spanish Town and Linstead. So I did the
Wow.
typical, I did the typical internship, Bustamante, Jubilee,
Hmm.
KPH, you know?
Trenches,
Yeah.
Trench.
And
trenches,
then
trenches.
I did the SHOs at National Chest Hospital,
Hmm.
Surgeon Golden Rehab Center, and I did St. Thomas, all the health centers, and I did some work at Princess Margaret Hospital, A&E.
Nice.
And then I went to KPH again, medicine, and did MO in internal medicine. And
Hmm.
then I transferred to KP to National Chest and continued there as an MO throughout, well, when the pandemic started, and then resigned.
Yeah, I remember that's actually how I knew of you from like your tweets on Twitter throughout
Oh,
COVID and at
Oh yeah, I
National
think I
Chess.
saw those. Yeah.
yeah.
Yeah, and you helped like even some of my friends or some of my friends' parents actually still
Oh,
talk about you and saying
oh,
really good things about you. Yeah, and how you
oh,
treated them on the
nice.
COVID ward when they were actually admitted and so on. So, yeah,
Yeah,
kudos to you. Kudos to you. You did an
yeah.
excellent
I
job.
mean, I don't regret any of that. I had to leave, but I don't
Hmm.
regret any of the time I spent there. I think I needed to be there. You know.
Yeah, felt. Yeah,
What
COVID
inspired
treated
you
us
to?
all. Oh, go ahead. Go ahead.
What inspired you to transition from, hospital care to starting your own business?
Oh, I just got sick. I really wasn't. I didn't leave thinking I'm going to start my own business. I left with no plan. I left because I was sick. I had.
Like sick of
was
this or like actually
I
sick?
no actually sick. I fainted on the COVID ward and could not move my right side and I could not speak for a short
Wow.
period of time. And you as physicians know what that means.
Yeah.
Um, so and at that time I had to be on extended, medications and extended sick leave or not sick leave. I guess I went on no paid leave. Um,
Wow.
and then while being on a no paid leave, I realized, anytime I felt stressed, and I just wasn't up to par to take on that stress anymore. And so I
Hmm.
just decided I wasn't going back. I needed to
Yeah.
take care of my health, and so I decided not to go back. And so
Yeah.
it
Sounds
was during
tough.
that time I was, figuring out me and taking care of me, and then I said I need to do something that I really love to do something that involves taking care of me, but still taking care of people. And that's where, I went into the whole aesthetics. And I
Mm.
decided, hey, let's take up my savings and invest in doing this new specialty after spending so much money doing all those other specialties.
Yeah. Yeah, of course at John Hopkins and so on, all of those
Yeah, that
things.
wasn't that was that was not cheap.
Yeah, I can imagine. But you went all in, you doubled down on your dream.
Yeah,
So now aesthetic medicine. So for a lot of people that don't really know what aesthetic medicine is, can you give us like a little the
I said no.
lowdown, yeah, or
Sure.
a synopsis of what exactly this branch of medicine entails?
For simple terms, I would say aesthetic medicine is the medicine of beauty, or cosmetic medicine, and it's somewhere in between dermatology and plastic surgery. So minimal invasive, so it's not surgical like plastic surgery. And in terms of dermatology, it's aesthetic dermatology. So you just pick that part of dermatology where you're just dealing with beautification of treating the skin, like acne and the skin issues, and how to prevent certain things that come with aging of the skin. So that's what aesthetic medicine is, right? And so that's why it's not just the face; it includes the body as well, because it goes from head to toe, really and truly. Because I do hair restoration, minimal invasive, so I'm not in hair transplants. We do everything on the face: Botox, fillers, facelifts, skincare, regenerative skincare for me, because I did also a subspecialty in anti-aging. And so when it comes to the body, if you want, I wouldn't do surgical liposuction. I'll do minimally invasive or non-invasive belly fat removal. I'll do muscle sculpting with a machine as opposed to being surgery. So that's really what it is. It's minimally
Mm,
invasive cosmetic medicine. And I say
yeah.
medicine because people still, people have this notion it's not medicine. It's medicine. It should be done with training by somebody who had medical background. So
Yeah.
you're doing it safely.
Yeah, there's some stuff you were teaching me too, even with Botox and how you
Right.
have to know like the different facial
Facial
muscles
muscles.
and
Because
so
why would
on.
you want somebody to give you Botox who doesn't understand the anatomy of the face?
Yeah, yeah, exactly. And so many other procedures and so on, PDO threads. There are a lot there's a
Yeah.
lot out there. I
Leon is
oh,
frozen.
He
I'm frozen.
froze.
He got Botox, he's frozen.
Are you guys serious? You can't hear me? That's
Yeah,
crazy.
you're
We're
back. Well,
hearing
you're
now.
back
Oh
now.
wow. I could hear you guys. You said I got Botox
Botox
and got
works a little
frozen.
too good.
Just a tad bit too well. But I don't even remember what I was saying. I was saying, oh, we were talking about
The aesthetic medicine. What's the process like to become you mentioned board certified aesthetic medicine?
Yeah. So, in America, they do boards. Out here, we do DM1, DM2. So, in Jamaica, UA doesn't have an aesthetic medicine program. They have plastics now, and that's new. We know that's fairly new. They have dermatology now. Again, that's fairly new. So, imagine aesthetics. I don't know when that will come. Hopefully, I can do something to bring that here at UA. But so for me, I had to go. I had to do it in the US. So it's the same thing. So it's boards will be the equivalent of DM2 here, I guess. So you do the different steps. Step one, step two, and then you do the board exam. The board exam is written. So you have a written paper, and then you have the oral, which is hard, but it's the same thing. You get cases, and they grill you with questions, clinical cases, and so on. So, and then
mm,
once you pass, your board certified aesthetic medicine physician. I don't know how it is in other countries, but in America now, it's an international accreditation. So I could go anywhere in the world, and I am board certified. My qualification in aesthetic medicine is valid in any country once you have the license to practice in those countries.
mm, okay.
So how long
Okay.
did
How
that
was that?
like
Oh
like
yeah.
how
How
long
how
did that
long?
process take?
How long did it take?
Yeah.
So it takes a minimum of 1 year minimum. Um, no, it's quite expensive to do. So it's a year, and during that time, how it is spaced is so that you can be practicing. Especially when it comes to the board exam. If you're not practicing, it's kind of difficult because it doesn't make sense You can't do a clinical exam if you're not practicing and seeing the patient. So you don't have to do the step one, step two right back to back to back. So, but if you do it back to back, it will be a year. Um, you can extend it based on one, the amount of practice that you're getting, or two, your financial situation. Because if you don't have the money to do the steps back to back, then it will go longer than a year. But the minimum is a year. So that's how long it took me to the American board exams. But I had done the Russian um, aesthetic dermatology certification prior to, and I did some observership as well in Botox, pedio threads, and filler outside of
Mm.
that.
Uh, can you just tell us a little bit more about some of the things, some of the services you offer? Because you mentioned Botox, you've mentioned fillers and so on. What are some of the things that you do as an aesthetic medicine, as an aesthetician?
Nope.
I say nope,
An
not
aesthetic
aesthetician.
medicine
Very
physician.
good.
Right.
Aesthetic medicine
Wait,
physician.
what's the
Physician.
difference?
Completely different, right?
So an esthetician is not a doctor or a nurse or a medically trained person.
Okay. Okay.
Yeah.
So
Um,
aesthetic. Can you say it again?
medicine physician.
Aesthetic medicine physician.
Physician, right.
AMP.
So
Got it.
what do I do? So I do skincare.
Mm-hmm.
So when you come to see me, you can do a skin consultation. If you just have skin issues, skin consultation, we go through a routine and we set up a plan for action for your skin and follow up and so on. So it's medically managed skincare, like going to a dermatologist. Um, we do, and then the procedures that follow, whatever it is, microneedling, whatever it is you need for your skin to treat whatever skin issue you have. And then we go on to the aesthetic procedures that include the hair. So we do PRP or PRF, platelet rich fibrin. So we take a part of your blood, inject it back into the scalp to restore your hair, both in men and women. So the men who are balding and the women who have lost some hair for whatever reason, we replace that hair or allow the hair to regrow by injecting plasma from your blood. Um, we do facelifts minimally invasive with pedio threads. Pedio threads are a Korean technique using collagen fibers that dissolve under the skin to lift the skin and tighten the skin. We do filler, we know lip filler, to increase volume in various areas. We can do it in the body as well. We do Botox to relax the muscles and get rid of wrinkles. We do belly fat removal, minimally invasive, muscle building, abs, glutes. If you want to get that rounded, voluptuous look, you can do that without surgery.
Mm-hmm. Mm-hmm.
Chemical peels, the runs.
Yeah. Okay. There's
And
even
then,
some one you
apart
told
of
me about actually
what's
that was
that?
hilarious. The extracorporeal shockwave therapy
Oh, all right. So
for
that goes
men.
into now the anti-aging. So that's the
Ah,
anti-aging. So that's
that's
not
still a
aesthetic.
part of anti-aging.
So that's
Wow.
anti-aging. So you can do aesthetic medicine and you can do anti-aging. So I did a little a master in anti-aging and specialization in anti-aging, and that took into play IV vitamin therapy. So I have an IV lounge which I'm in now, which they mentioned, where we use various vitamins, and vitamins are also drugs. We can't
Mm-hmm.
just get up and say, "Oh, I'm giving vitamins." No, you have to know dosage and why it's for, what interacts with what. So we give IV vitamin therapy, combination of various things for different things. We do, so that's anti-aging, or it goes into the realm maybe of alternative medicine. And he is talking about extracorporeal shockwave therapy. This is what we use for treating erectile dysfunction here at my office. It forms new blood vessels in the penile tissue or in the penis. And we can still use that technology to treat joint and muscle pain. So the physiotherapist will use that for people with arthritic pain or muscle pain from the guys who got injuries from athletics or just gym. So
Mm-hmm.
yeah, so I treat erectile dysfunction. That comes under the umbrella of anti-aging.
And that's long lasting, meaning
Yes, it
it's not
is.
just
Once you
one
don't
shock and
do,
that's it.
not one shot, it's a series of treatments.
Okay.
But after you've done the series of treatments, and once you don't go back to the things that cause you to have erectile dysfunction in the first place, you should maintain your results for up to even 2 years.
Nice. Wow. Wow. You hear that, guys? So you can. It's not just for women, right? Clearly, aesthetic medicine is way more than just women. Also, men can have some,
Benefits.
touch
I
ups
have
here.
men who come and do Botox and treatments.
Okay, love that for you. So how do you see aesthetic medicine evolving right now in Jamaica?
Uh, it will evolve because, as I said, we're all exposed to social media. And social media is a good thing in that it brings the world closer together. So we're seeing all these things that are bread and butter, like water in Miami, where I was trained for the most part. You're seeing this commonly done there, and so for us, we're like, okay, we need to do this because I'm seeing it on social media. I need to do this too, and so it's becoming more common. The problem is for us here in Jamaica, especially when I look at it with my clientele, it's the older, not say older, I would say mid 30s upward. That's majority of the persons who are coming in to get these things done. And it's not that the younger folks don't want to take care of their skin and so on, but it comes down to disposable income. Because most of my patients aren't sick, you know. I don't even like
Yeah,
to call them patients, I call them clients. They're not
yeah,
sick. My office is a feel good environment, and you're trying to age as healthily as possible, and so they're not sick. They're coming in. They're trying to get their skin to the optimal look. Enhance what they have or maintain what they have. And so these are the persons who are have the disposable income to spend on things like this. Whereas in America, I guess the younger age groups have that money to spend. So it's not as you don't see the rush as in America, in Jamaica, but it's picking up because I still have 20s here. Once they have the needs, they'll come and do these things. But in America, oh boy,
mm-hmm. Yeah,
it's more common. And then in Jamaica, it's still new. Jamaicans, first of all, Jamaicans don't age the same way. We have Jamaicans who are 60s looking like 30. I
yeah,
mean, so
true.
the reality is that you don't need to do anything.
Mm-hmm.
But in Jamaica, it's still very taboo. Botox, no, I don't want to do that. You tell them,
Needles.
yeah. So it's still very taboo, and it's taking a little time and easing my clients into saying, no, it's okay. So they want to do it, but they're still very hesitant because in their minds, they're going to look fake and frozen, and that's what they're used to seeing. And they don't want to do Botox because people are going to say they look unnatural, and they're not. So
Mm-hmm.
it's getting there, but it's a little step. And first step, I think, to get patients or clients comfortable is proper training. Because not many persons in Jamaica are properly trained or have the correct certifications. It makes the patients less confident in getting these things done. And so when we have wider training and wider regulation of aesthetic medicine, then people feel more confident and comfortable to have this done, and it will pick up a little faster.
Hey, limit breakers.
If you're finding value in our content, don't forget to like and subscribe.
It really helps out the channel.
Thanks for your support.
What were some of I'd say, the most significant challenges that you faced when you were establishing your brand, and like how did you overcome those challenges?
Oh, establishing a brand. As Diane said, my brand was established a lot on social media, especially during COVID. I didn't think COVID would be a brand building time for me. Some of the challenges I established were, and this is common everywhere, it's perception. You're one way, but people are going to perceive you as something else. So people create what they think you are in their minds before actually meeting you, and that's what happens a lot on social media. They'll see one thing and that's it. But also, some of the challenges were misinformation. There's so much
Mm-hmm.
information around. Let me not admit, there's so much information around, and so people pick and choose what they want to believe, and so that was a challenge trying to overcome all of that. So that was during the time of COVID. Another challenge was people. I guess people's you see a face, but you're trying to make a connection with that face. So like even somebody came into my office and you don't look like a doctor. So that was one of the issues I had.
I get that all the time.
So they
Yeah,
say
it was
you're,
one
as
of
in you look too young, or
yes, like you're too young, or you look too young, or you just expect it to look more nerdy. I don't know what that's supposed to mean. Somebody said, you should look more nerdy, or you
Yeah,
know,
well, I don't know. I've gotten that, and I think the perception is, well, a lot of people prefer their doctors almost like senile. So it's uncommon to see a lot of younger doctors who are very brilliant and so on, and have the certifications and all the
yeah,
qualifications and the just the information in their heads, and they
yeah. So
still
it's
feel a
that
bit uncomfortable just because you are young,
right?
and you do look pretty young. I'm not gonna the
Yes,
anti-aging stuff working. That's just from my perception.
yes. It was a
Um,
connection. It was a connection with what you. So you see on social media somebody talking about these illnesses and whatever, you're like, wow, that person's so knowledgeable, nice. And then when you see them, you're saying, but that's a child,
yeah, yeah. Because you said your school fee was like when you took the half, that was like 1.1. So if I do the math in my head, I'm not sure when you graduated, but you also look much younger than I do. So I'm sure it would throw off people for sure. I understand it, but I
Yeah.
guess that's just a testament to your work, and so congrats. Yeah. So you are now an entrepreneur.
I guess
Big
so.
shift. Big
It
shift
is.
from being a doctor, right?
Oh no, it's huge. It's a big shift.
Mm-hmm.
Um,
Tell us about that. What was
it's
that like?
it's been this year has been one of the most exciting, but one of the most stressful years of my career.
Mm-hmm.
Not even COVID. And when I was doing through the pandemic in the hospital, I was saying that was the most challenging time of my career. And I'm saying, okay, nothing can beat that. This is it. Because I'm in a whole different realm. I never did any business subjects in school. I was just doing science. And so what I had to learn now is how to not saying stop being a doctor, because I mean medicine we don't learn much about business. I think we should include some of that, the business of medicine,
Yes.
because right, because we don't, in the hospitals we have nothing to do with administrative parts of medicine. We're just treating. So
you
I
don't even
had
know
to
the
learn how
cost of
to
a
run
lot of
a
stuff.
business. Yeah, and so I had to learn how to run a business. Luckily, I had done that specialization, that diploma from University of Washington in leadership and management in health. So it taught me how to run a medical facility,
Mm-hmm.
to some extent. But in the business aspect, so I had to learn how to do accounting. While we have an accounting firm, I have to still understand how the money moves, expenditures, and all of that.
Mm-hmm.
How we're spending the money, how am I going to expand the business, how fast I need to, so all of that I had to learn very fast.
Yeah.
Skin by Doctor in business itself is only 9 months. So I had to learn that, right before I opened the office. That was very challenging. And then I had to learn how to manage human resource, which I think is probably the hardest thing. In hospitals, we're just managing, for me as a resident, I was just managing my interns, SHOs, and you work with people and so on. No, I have to be in charge of families. Quite frankly, I don't. So my staff, I don't consider my staff, for me they're team members, because all a team. Not because I own the office. We're all working to make this a success. And
Mm-hmm.
so I'm in charge. I'm responsible for their families because I have to ensure that they can feed their families at the end of the month.
Mm-hmm.
Right? That was a big thing for me, and I'm saying, whoa! It's not just about me making a salary for myself. I have to make a salary for the other 6 people who are employed here. So
Yeah.
that was big, and I have to reshuffle resources, human resource, to make sure that they're performing optimally. I have to bring out the most in them so they perform optimally, so that we can be successful. So that was, a lot. Because as I said, I had no business background, formal business background, no financial background in medicine. I had to just learn this. So even though I'm actually about to start another thing from Harvard Business School, because there's still so much to learn in that aspect.
Yeah.
But I have good mentorship, I have good partnership in terms of business that guide me. I think I would say I have a strong support system.
Okay. Wow. So is that how you balance the demands of, running the business and your personal life and so on? Like, what tips do you or can you offer for other people? Because you said you have a strong support system. Is there anything else that helps you to keep
Oh,
grounded
I have
and
a strong
focused?
support system with regards to the business.
Oh,
I do say, I will say, I'm not going to pretend, I don't have a good balance in terms of work life balance. And I don't think that's abnormal. I think one of the things that comes with being a good entrepreneur, anybody can be an entrepreneur. You can go and you can learn it at school, you can do a degree in entrepreneurship. But a good entrepreneur is usually a natural. I think one of the things that comes with being a successful or a good entrepreneur is understanding the importance of sacrifice. If you're not willing to sacrifice, then you probably won't ever be successful. And when I say sacrifice, it's not just, oh, I'm sacrificing money or whatever. Sacrificing time,
yeah.
quality time.
And you're also a doctor too, and that's,
Exactly.
as
So
a
I'm not
doctor,
just running a business.
sacrifice. Yeah.
Exactly. I'm not just running a business. I'm not just in meetings. I have to see patients, do
Yeah.
procedures while doing all of that. So when the office closes at 6, I'm done doing the doctoring, and I'm no the staff leaves, and I'm here checking off their accounts, talking to the accounting team, sending off emails, doing up business plans and proposals to meet with so and so, and seeing how I'm checking off the balances. How does am I meeting my targets that I set for this quarter and that quarter, and so personal life gets put on the back burner. I haven't gone out in a long time. The most I can do is go to Summit because it's right
Yeah.
here.
Exactly.
And when I travel,
Apex.
people say, "Oh, but you're traveling a lot more."
Hmm.
No, I'm traveling because of school. When I
Yeah.
was traveling, it's because I'm doing my training in Miami,
Yeah.
right?
Yeah.
So, and this is a Sunday when the office hours, we're not open on a Sunday, but I'm still here because a patient needs to be seen on a Sunday, and I need to come out and I'm going to do it. And so today I'm the front desk, I'm the nurse, I'm the doctor.
Hmm.
You
Yeah.
understand? So it's a lot of sacrifice, and so a lot of your personal time is going to be sacrificed. I think in the last 2 months, I don't think I've slept for more than 4 hours, which is bad. So now I'm trying to see how I can pencil in more sleep.
Yeah.
You know,
Yeah. Takes a lot
yeah,
to get a business off the ground like that. And you mentioned big goals because you mentioned expansion a
of
while ago.
course.
Wow. Can you tell us anything about that?
I will. And that's the next thing. In Jamaica, I always say we're a small country, but I will always encourage persons, whether you're a business owner or you're an employee, always think big no matter what. And I think sometimes we fall into this trap of saying, oh, Jamaica is small. I have a small business and we leave it at that. No, you don't want to be a small business. You want your business to grow and expand even beyond the boundaries of Jamaica. So I want to expand outside of Jamaica. It's gonna happen sooner than you
Hmm.
think. But,
Wow.
I want
Speak
to
it into
expand.
being,
I want to
manifest
expand
it.
outside of Jamaica. I don't want to, just sit in this office for 30 years. You want to expand the reach. You want to grow the product very fast too. And this requires studying the market and studying the economic climate and see how you can pivot and take advantage of the different the ways in which it's going. The
Yeah.
economic climate right now is very vulnerable. And so don't be afraid of the vulnerability. You lean on the expertise that's available to you, the resources available to you. And that's what I was saying. So every day I'm sitting down and I'm looking at how can I manipulate all that's happening? How can I take advantage of all that's happening and not be scared or dissuaded by what's happening? And as I was saying, you want to expand very fast because when you don't try to expand very fast, you become complacent and you just sit and you don't realize that 6 years has passed and your business has not grown anywhere. You
Hmm.
know,
Yeah, you missed a
so
lot of opportunities
you
like that.
missed opportunities, right? So for me, like, and how do I do this? While I'm just the CEO and it's just me, every week my team members, we have a meeting. Every week we have a weekly meeting, And each person, the nurses, the additional doctor, the marketing person, front desk, we all have targets. Even myself, we all have targets, and you have to make 70% or more of your targets. And we see, okay, what could you do to increase your target next week? What was the issue last week? And these targets are not just, oh, we want to make targets, but the targets affect profit. And if we make these profits, we either break even, make these targets to break even, or we make our profits that we projected for the year. And so, it's a small business, it's just a doctor's office, but I see it as a big old corporate company if you think that way. And that's the
Yeah.
only way. If you think that way, then it won't be difficult to say I'm expanding here, I'm expanding there, because once you think that way, you start to figure out the routes to get to where you need to get to.
Okay. Love that. Okay.
Um,
Okay, go ahead, Preston. Yeah.
yeah. So, what advice would you give to young doctors who are also looking to go into entrepreneurship?
All right. So the first thing I'll give to young doctors is do a lot of research in the various fields and subspecialties in medicine, or from early. When I say from early, from even before you become a doctor, from fourth year, because that will guide what you do. I'm not saying I wasted 6.5 years, but I wasted 6.5 years. Because if we're not knowledgeable of the various arms of medicine and the subspecialties and various things you can do, then you get boxed into say, I need to be a surgeon, and I need to be a um, gynecologist, and I need to be a this. I didn't even know there was aesthetic medicine, and the pathways to go. Even the doctor who's working with me, she thought she needed to do, and a lot of young doctors come to me and say, do I need to go do dermatology? No, you don't, because it's not, dermatology is broad. I just picked a part of dermatology. Do I need to go do plastic surgery? No. So do research from early on the various aspects of medicine, and then get some business background, because that's what will fuel where you go. Be guided by persons who you emulate, and it doesn't have to be a doctor per se, because a lot of people that emulate are business people. And I see how they transform their businesses, and so while it's not a medical business, I use their models, and try and extrapolate and apply certain models to my medical practice. And so you run it in a similar way, and you'll see the results. But as I said, for young doctors who want to become entrepreneurs, educate yourself in business. Um, and I would say take on a mentor in business. It doesn't matter if they don't know medicine, you still need somebody who understands business to guide you in that aspect. The medical part of it is not, when you look at it in the grand scheme of things, it's not what's going to drive the success. It's really understanding business and business development and how to grow a business.
Do you have a mentor you want to big up?
I have quite a few. Some of them are new. David Walcott. I mean, I would say outside of me, of course, no. But if you want to branch off into entrepreneurship and so on from medicine, David Walcott is a big one.
Big up,
Um,
David.
yeah, for sure. Theon Sims.
Me.
Yes, I think Theon doesn't want to admit it, but I mean Theon, taught me a lot about finance,
Wow.
and,
Okay.
and he's hiding his knowledge, but it's okay. Kevin Donaldson has been a good mentor for me as
Mhm.
well, and Mr. Beresford Gray from Cygnus has been a very big one. So those are the persons I would say who are constantly guiding me in how I manage my business, how I grow, how I develop as an entrepreneur, and so on.
Okay. Okay. So we're kind of wrapping up. But in this segment, I kind of want to know, can you share like a memorable experience or a success story or something that really resonated with you recently, from your practice? Or anything cool you did, anything to leave
Oh
with
boy,
the
I do cool things
folks.
every day.
True, true.
um,
You said you took plasma and you use a lot of like the growth factors when
yeah,
you, and then you use that's pretty cool. That was always pretty cool to me. I was just like, wow, you stimulate growth from like platelet derived growth factors and all of those stuff. I love
yeah,
that. Love that. But
yes.
yeah, talk to us.
Um, oh boy, so many things. All right. I would say for me, the most inspirational thing or most significant thing I would say recently.
Giving a guy back an erection though.
Oh,
Has to be top 10. Has to be top 10. Yeah, well, I'm pretty sure these guys, I'm pretty sure the wives come to you and thank you and leave like gift
Send her a
baskets and
basket.
things. Send her a basket. I'm pretty sure.
true.
No?
I think for me, it's oh boy. And sorry, I'm not trying to leave out our men here,
Mm-hmm.
but I like empowering women. I think for me, and it happens quite a bit. I get it often, but it's for me, it's women, and there's nothing wrong with wearing makeup, by the way. But for me, it's women who come into the office, and it happened very recently too. Who come into the office and said, "Doc, you don't realize I don't wear makeup anymore." And I'm like, "You're not wearing makeup?" And their skin is pristine, not a blemish, nothing, and they look like a. So one of our, she's 79. I think she's our oldest patient, and she said, "Doc, I I tried to open my phone because she has a little accent, you know, 'cause she's
Mm-hmm.
coming from New York. I'm trying to open my phone, and the face, what's it called? The
Face
Like the face
ID.
unlock? Oh,
face
yeah.
unlocked. It didn't recognize me. I was getting frustrated, like I was getting frustrated because I was thinking something the phone was defective, and then I realized, oh. I don't look as stressed and drag anymore. I have a whole new look now, so I need to do
Yeah.
it over. And I was, and the entire office was laughing. So she's like, "You need to put in your consent that your Face ID may not work anymore." But I'm so
Oh,
significant.
gosh.
But she was a whole different lady. I mean, she was confident before, but
Mm-hmm.
now she felt
Mm-hmm.
so good going to her old high school reunion. She was showing off like she looks brand new. And that was so funny to me. I think that was hilarious actually. How just
I
that she
love
was
that.
getting so upset about to do away with the phone because why is the Face ID not working all of a sudden? That was a good one for me. That warmed my heart, man.
Okay, love that, love that. Just to leave with the people, how can they get in contact with you?
Oh, okay. So one, you can follow us on or go on our website www.skynbydrkym.com, and it's SKYN by
Mm-hmm.
Dr. KYM. Or you can follow us on Instagram, Skyn by Dr. Kim, TikTok, Skyn by Dr. Kim, Twitter, Skyn by Dr. Kim. We're located at Summit, which is formerly Knutsford Court Hotel, which is at 16 Chelsea Avenue in New Kingston. Or you can call our office at 876-594-7300.
You can tell she did that many times before. Many times
Few
before.
days ago on Zip.
Yeah.
Yeah, and we'll put
I mean,
we'll put all those links in the description, guys.
100%. Guys, if you love this episode, just give us a thumbs up, give us a little like. If you really liked it, you can sub to the channel. Thank you so much, Kym, for coming on the
For
show.
having me, and everybody think big. I mean, the sky's the limit. Limitless.
Limitless. That is it. Limitless.
We didn't tell her to say that, guys.
No,
We didn't.
no.
This is not a paid advertising.
No, but
All
it
right.
really is. Just think big.
Okay, love that.
All right, bye.
All right, guys. Thanks.
Peace.
Limitless. Out.